Hi there and welcome back. Let's review multiple sclerosis today, or generally known as MS. Multiple sclerosis is a disease in which the immune system eats away at the protective covering of nerves. In MS, resulting nerve damage disrupts communication between the brain and the body. MS is autoimmune disease of the central nervous system, that is brain and spinal cord. Although the exact cause is unknown, MS is considered to be an autoimmune disease and progression is unpredictable. Research is ongoing into developing new medications, immune system modifications, and other ways to identify potential multiple sclerosis causes. So, what are the symptoms? Impaired vision, ataxia, spasticity, paraplegia, bladder symptoms, and altered mental state are the typical symptoms that we see in MS. I'm not going to go into the details about the types, but generally you will see in a literature the first and foremost there is a benign MS, relatively speaking less concerning, but then you will have relapsing, remitting. That's the type of MS where there are periodic attacks and then you are at a near remission, then again there is a relapse, and eventually that relapsing remitting MS turns into secondary progressive type of MS, and then ultimately, and actually by the way the secondary progressive is the most common type statistically speaking, and then ultimately we have another type that is known as primary progressive. So those are the things you will see in variety of literature. Let's talk about the diagnosis. MS is diagnosed by a patient's history, physical exam, and tests such as MRI, lumbar puncture, and evoke potential testing, speed of nerve impulses. Other tests may be done to rule out other diseases that may cause similar symptoms. Diagnosis depends on history of at least 2 separate episodes of neurological dysfunction or gradual stepwise progression involving 2 or more areas of the central nervous system. MRI shows multiple white matter lesions frequently in periventricular regions, cerebellum, brainstem, and spinal cord. Statistics: fewer than 200,000 US cases per year when we talk about MS. Disease of young adults, rare onset before age 15 and after 40. Onset from age 20 to 40 in 70% of cases. Peak age of MS onset is about 5 years earlier for women than for men. Female to male ratio of cases is 2 to 1. We were referring to the relapsing remitting multiple sclerosis. That becomes secondary progressive in 50% of cases, another type of MS. Suicide risk is 2 to 7 times higher than general population. Lots of statistics out there. Treatment: no cure unfortunately is available. Steroids, ACTH, interferon, and immunosuppressive drugs may hasten remission or reduce frequency of flare-ups. What are the complications when we deal with MS? Complications includes depressions, seizures, plus bowel and bladder dysfunctions like urosepsis, chronic renal failure, and respiratory compromise such as pulmonary emboli, pneumonia, or aspiration. There is increasing disability with MS which arises from damage caused in relapsing remitting MS, secondary progressive MS, or primary progressive MS. Something to make a note of. So how do we underwrite? Do we have the definite diagnosis in the records? What is the type of MS? Onset age. Is MS progressive or stable or in remission? Correlate with symptoms, last attack, frequency of attacks, are there any complications or disability, and plug those details into your manual or company specifics to arrive at the best possible offer based on present evidence that you can extend. So with that, let's take a break here and see you soon. Take care. Bye now.